Good morning, everybody. And first and foremost, again, to the frontline supervisors and to the essential employees and to everyone that's out there, thank you what you're doing. As always, I want to make sure to let you know you're in our thoughts and prayers. And sadly, today, we had two people pass away last night in Albany County. One in her 70s and one in her 80s, both with underlying health conditions. And sadly, one of them was a resident at our Shaker Place. So my condolences and my prayers go out to the families and to all the other 51 families that lost somebody. It's a difficult time, as always we say, and it's hard to imagine losing someone in these difficult times when you can't see that person for the last time and hold their hand and comfort them in their final hours. So again, to the families, our condolences and prayers go to you, and to the other 151 families. It brings us now to a loss of 53 Albany County residents. As of today, we have 1,252 cases. It's up 16 from yesterday, and we have 1,093 people under mandatory quarantine. That's up 14 from yesterday, and we have 8 people under precautionary. That's up 4. And some of the good news with the aggressive testing, you kind of see, are we going to hit the APAC? Are we going down? And I don't want to put a false hope out there, but looking at the last 5-day average of the amount of testing that we're doing and the positives coming back, it's averaging about 20.2 new positive cases each day, which is a good sign, because as we continue to aggressively test and we're getting negatives back, that's a good thing. One of the things I just want to bring up and let everyone be aware of, the Tresian House was handled with an outside private agency. So them cases that were reported into the media, we don't have them yet. So that will give us a spike on one of these days coming whenever that number gets to us, but we are not tracking that number officially until it comes to the state DOH dashboard and gets down to us. So we have, as of today, have 2,862 people that have completed quarantine. 664 tested positive for the virus and have recovered, which is also good. 32 people hospitalized at a hospitalization rate of 2.58. And we still have 8 people in the ICU. I also want to remind everyone, if you need an appointment for our mobile testing site, as always, 518-465-4771, 4771. And again, through the Colony Rite Aid testing site, you can go online and do www.riteaid.com. And as of today, we've done 1,368 tests for the Colony site. So please, with all the sites, please continue to utilize them, because the quicker we get that data in, the quicker we get the mapping and tracing in, the quicker we can open up the doors and do it in a safe manner. We have the urgent care in Guilderland, as always, to mention that. And today is National Nurse Day. And I know many are honoring and thanking nurses around this country. And I especially want to thank all the nurses out here in the Capital District, especially in Albany County, but all of our healthcare workers and our nurses down at our health department. Because, look, we train for every scenario. We try to. Same thing in the military. You try to train for everything that you think that's going to be thrown at you. This is something different. And we had to reinvent the way, or I like to use reimagine, the way we used to do business and the way we handled crisis. And who better than to talk about it than our head nurse, who's been down in the trenches at the health department, dealing with this day in and day out for the last, probably put in as much time as I have been in without a day off in the last 50-some days. But to talk about how it's redeveloped and how we continue to change and evolve with the situation, to adapt to the situation and to make sure we're doing everything we can to protect the people. But Kathy DeThomas is our Director of Nursing. So please, Kathy, talk about it.
Thank you, Mr. McCoy. So on National Nurses Day, nurses are recognized for the work that they do for the people of the community. Nurses strive to promote health and well-being, prevent disease, and provide compassionate care to their patients and to their families. And every year during this week, it is important to acknowledge and celebrate nurses for their dedication to the art of nursing, ensuring that every person receives the highest quality of care. Everyone knows, in general, what nurses do. However, this year is special because for the first time, people are actually seeing firsthand what nurses are doing and what it's like to be a nurse in the midst of a pandemic. Every night on the news, we see nurses working in hospitals with COVID-19 patients, and they are our frontline warriors, and they are to be commended. But right here in Albany County, at the Albany County Department of Health, we have a dedicated team of nurses who are doing very important work for this pandemic. These nurses, along with other agency staff, are conducting invaluable disease prevention measures. They call every individual who tests positive for COVID-19, collect their contact information, and provides them with education and strategies to prevent further spread of this illness, including the importance of adherence to isolation and quarantine orders. They ensure that patients' needs are being met throughout this time, and they facilitate testing for all contacts whenever needed. Our staff work closely with community agencies experiencing outbreaks of COVID and provide guidance measures to further prevent the spread of illness. Our team works long hours, as Mr. McCoy said, oftentimes double shifts, evenings and weekends, to ensure that every individual who tests positive for COVID-19 is contacted the same day their laboratory result is reported to the health department. This is vital public health work. Education and contact tracing are key in preventing further spread of this illness. And this is what we do every day at the health department. In addition to doing COVID-19 work, the nursing staff provide an array of services to county residents. They provide home visits to maternal child health patients, test and treat individuals for tuberculosis, ensure that children's immunizations are up to date, evaluate and treat for sexually transmitted diseases, administer treatment to individuals who've been exposed to rabies, and the epidemiology staff investigate all communicable diseases that are reported to the health department. And these are just some of the services provided by Albany County Department of Health. When you think of public health, know that this is the work of these individuals or our frontline workers. They are the faces of public health. They strive to maintain the health of our community. As the director of nursing and a nurse myself, I am honored to work with such a dedicated, knowledgeable, caring, and hardworking team of nurses. And I can say with confidence, the residents of Albany County have the best nursing staff working on their behalf. So happy National Nurses Day and National Nurses Week to the nurses at the Albany County Department of Health and to all nurses everywhere. Thank you.
Thank you so much. I appreciate that, and for everything that you're doing down in the health department. Liza.
Good morning, everybody. I just want to thank Kathy for her words and for her service. I really feel every day when I go to work how lucky I am to work with the people that I do work with at the County Health Department. We have a tremendously dedicated staff. Often for public health, you hear that when we're doing our work well, you don't hear about us. And there's so much that we do before the pandemic that helps to influence outcomes of many health disparities and health conditions in the county, that it's important to take this opportunity to highlight that work as well. During the time of the pandemic, as Kathy said, our workers have really gone above and beyond to ensure that that appropriate contact tracing is done. And when we look at how the response to COVID-19 has occurred, we know that our frontline health workers are essential in controlling the spread. As we are able in Albany County to do the amount of testing that we have been able to do, we have been able to trace contacts of all these individuals, and that is what the most important work that we do to flatten the curve, along with social distancing and the other strategies that we have promoted. So I'm very proud of our staff. I'm proud of the nurses that I'm lucky to work with every day, and all the other workers at the health department who are essential in this contact tracing and follow-up to stem the spread of COVID-19 in Albany County. We continue to see cases in the nursing homes and are following closely along with the state health department to make sure that those investigations are taking place to stop spread to our most vulnerable residents in Albany County. This is going to be something I think that we've trained an eye on from day one. But we need to look at additional strategies that we can employ to assist with the spread in these communities. We continue to be focused in our work to promote the important strategies of community mitigation. As I said yesterday, despite the discussion around opening up, there will not be opening up without these important mitigation strategies still taking consideration to all of our interactions going forward. So the lessons that we've learned over the past couple of months are going to be lessons that we need to carry forward into any kind of reopening. Strategies around frequent hand washing, social distancing, wearing masks in public are going to be more important than ever. And for us at the County Health Department, it's going to be very important to watch very closely the data and response as we start to re-enter the community and ensure that we're doing what we need to do not to see additional spikes. Thanks.
Thank you, Liza, as always, and thank you again to all the nurses out there. I did want to share one thing. We got a letter from a family member, a Shaker Place resident, which truly shows how much our staff and nursing otherwise are caring for our most our residents at this point in time with everything going on. And you know what? I'm going to read a little bit of the letter, but basically, our nurses and everyone that works at our nursing home have made arrangements, so if people want to see their loved ones, they get them over to a viewing area where they can see them through a window. Answer the phone, their phones, takes their time to let the residents talk to their loved ones. But the letter reads, I want to just take a moment to send my gratitude and thanks to the staff taking care of my mom. The past 2 weeks have been especially hard on us as with a family, with my mom being sick and not being able to comfort her. The nurses and aides have been great about giving us updates, addressing our questions and concerns, answering the phone for my mom when she couldn't do so I could talk to her and facilitate window visits. So again, the letter means a lot, and I want to say thank you for that person to take the time to write it, and it means a lot to the staff out there. These are troubling times, hard times for our nursing homes across this nation, across the world, and they're in the battle zone every day, these nurses that go up there and administrators that work at our nursing homes in dealing with this. So it has not been easy on them, and then they have to go home and take care of their families. So please keep them in your thoughts and prayers also as we continue to go on. And I want to thank Bob Crandall, the Albany area president of AJ Gallagher Risk Management. We truly appreciate his gesture yesterday. They dropped off over 500 masks to us so we can get it out to our nursing home and to other areas. We'll get it out to the sheriff's EOC so we can get it to the places that it need to go. Also, I want to remind people if you need to use our mental health line, please call it. It's open 7 days a week, 8 a.m. to 8 p.m. The number, as always, is 518-269-6634. And as always, our 24-hour sexual assault hotline number is area code 518-447-7716. As always, the 211 in the New York State hotline, please utilize them. To all the questions we were getting from the business owners yesterday afternoon, I am working with my counterparts in this region to submit an updated plan to the governor's office on how to reopen. I want to commend Mayor Sheehan. She's been calling me every day to talk about different ideas and ways we can do this together. And John McDonald and Pat Fahey and all the rest of them, and Neil Breslin, thank you. We got to do this in a way that, like I said, first and foremost protects the safety and the residents here in this county. That's the only way we're going to be able to open up. So as we reach out to the Regional Economic Development Council and make sure that our plan gets submitted, we want to do this in a safe manner, people, but it has to be run through our health department. It's going to have to be the guidance of Dr. Whalen and her team and how we're going to do this going forward, and testing, setting up testing going into the future and for everyone. So please stay patient, and hopefully by Monday we will have this report up and out on the website and sent to the governor's office so we can start addressing this.